Hello, hello. Welcome back. This is lesson 7. In this lesson, we are going to be talking about CT anatomy and pathology basics. So I am just going to go ahead and just give you just like a rundown of some basic anatomy and pathology, just basics, just some concepts that you need to know while navigating your CT training. All right, so this is your cross-sectional anatomy basics, okay? So CT scans are an axial scan, as I've talked in previous lessons that are acquired. It's like cutting a loaf of bread and pulling out a slice, and that's how an axial image is seen, okay? So I'm pretty sure if you've dived into your training scanning patients, you'll be able to see that. Now, we also utilize different window levels to see tissue, bone, the lungs, all that, okay, that we kind of toggle through just to make sure that we highlight those different attenuations for those different soft tissue, bone, and structures. Now, thin axial images, this is what we use, this data set, to create our 3D volume rendering image. So those nice, pretty 3D vessels and the skull and all those things, that is acquired with an axial image. And usually those are stacked, they are stacked on top of each other. So they're overlapped per se, okay? Now, your coronal and sagittal reformats are used to see the body in different planes. So from front to back, superior, inferior, always anatomical to, anatomical position and the body position, right? So customarily, just 99% of our scans, everything has a sagittal coronal reformat. I can tell you that for a fact. There are some scans that we do, like a scanogram, where they're just measuring extremities, that it's just a scout and they just, they do measurements and we don't have to do that, which is, something for another lesson. Sectional anatomy books are a great resource to learn cross-sectional anatomy. I can't stress enough what, learning your cross-sectional anatomy is. If you have downtime, going through images and looking at different reports on scans you did to kind of familiarize yourself on the different types of anatomy on those axial images. Now, we do see some common pathology in CT. We do see a lot of it when we're imaging patients. So like common pathologies are, we see a lot of bleeds, stroke, PE, appendicitis, fractures, bowel obstructions, masses, cancers, things like that. We typically see those because, CT imaging is the way to spot those different pathologies. Now, to be able to spot a normal pathology versus abnormal, so all the pathologies that I explained before, we could usually tell what's normal and what doesn't look right. Okay, of course, let's say, for example, if you're doing a chest CT on a patient, we know that the lungs are supposed to be mainly filled with air. And all of a sudden you see, masses, cavitary lesions, or fluid that has built up in the patient's lung. Well, we know nothing is supposed to occupy that space except air, or even a pneumothorax where the lung is completely collapsed. So be able to spot that and kind of practice and do a lot of repetition is very good. I will dive into more pathologies and stuff in another course. So this is just to kind of give you like just a general consensus of this. Repetition and practice will get you familiar with pathology that's seen on CT image, just like I stressed before. So, reading those radiology reports on scans you did, saying, hey, this doesn't look right, or even talking to the radiologist and asking them is usually really good tools and resources for that. Okay, I know this lesson was short. Like I said, these lessons in this course is to kind of give you like a really crash course on it. There's other courses that I will have that will dive into more of these pieces, okay? So this is end of lesson 7. In lesson 8, we're going to talk about some advanced CT applications and kind of dive into that. So I will see you in lesson 8.